All right, thanks, Sam. Well, for many women, a breast cancer diagnosis is a scary, life-altering moment with many unknowns. Here to talk about what women should expect and explain the surgical options available to women is Dr. Heather King, Director of Breast Surgery with Hartford Hospital. Doctor, welcome.
Thank you for having me.
Great to have you back. So what should women expect when they're going in for their first mammogram, and what is the radiologist looking for?
So I think the most important part when women go in for their first mammogram is not to be scared. Okay, it is a relatively quick procedure, taking about 20 minutes. It's very minimal discomfort to the woman, and it's less radiation than even a normal chest X-ray. So I know women are concerned about that. It's great to make sure that you're getting the best quality mammogram. So always ask your facility to see if you're getting the 3D digital tomosynthesis mammogram. You want to also make sure that when you do pick the facility that you feel comfortable with, that you tend to stay with them and stay loyal year over year. It's always nice for the radiologist to have the mammograms from priors for comparisons. Also, make sure you're not wearing any deodorant, but don't worry if you forget, because they'll have wipes in there for you to wipe it off so that it doesn't interfere with the imaging. But most importantly, really, mammograms is important to get. It can save your life when breast cancer is caught early. Decreases your chances of dying from breast cancer by 30%. And women should definitely begin getting their mammograms at age 40 and therefore they're annually thereafter.
All right, so doctor, when diagnosed with breast cancer, women have many surgical options. What are the different types of surgeries available?
There are really two types of surgeries that are available. One of them is the lumpectomy, otherwise known as the partial mastectomy. And then, of course, there's the other extreme, which is the mastectomies. And in the mastectomy category, if you decide for immediate reconstruction, there are a couple types of mastectomies, including skin-sparing mastectomies or nipple-sparing mastectomies. With the nipple-sparing mastectomies, you're able to keep your nipple, and the incision's usually made underneath the breast or laterally on the breast next to the nipple. But it's really a discussion to be held with your breast surgeon with the best surgical procedure to choose.
All right, doctor, how soon after being diagnosed with breast cancer should someone have surgery?
Usually you should have your surgery or treatment started within 1 month. So you do have time to get additional imaging that may be necessary, such as an MRI or genetics testing if you qualify, and even if additional biopsies need to be done. This helps, the surgeon know your complete picture of the disease and know what the right surgery should be.
All right, treatment has evolved so much, even in just the recent years. Tell us more about the new technology and techniques that Hartford Healthcare offers to women.
So at Hartford Healthcare, we're really excited to finally have what's called a seed localization program. This is when somebody has an abnormality found on imaging. It's used at a time when somebody needs a lumpectomy. So what happens first if an abnormal imaging shows something and you have to go for a core biopsy of that finding, at the end of that procedure, a little clip is placed to mark the area of abnormality. Then, if that needs to be removed surgically, you actually show up to the radiologist again for a second appointment, and just how the clip was placed, a little non-radioactive seed is placed inside the breast next to the clip. That seed emits a special frequency to a special probe that the surgeon has in the operating room. So once you're asleep under general anesthesia and you're comfortable and the incision is made on the breast, the probe is inserted into the breast, and that probe then tells us within millimeters of where we are from the targeted tissue that needs to be removed. We like this. We're really happy about it because the advantages of it, we can actually decouple the radiology schedule and the surgeon schedule. So this allows the surgeon to do more procedures quicker, and that allows the patient to get their information sooner, and everybody's happy overall.
Excellent. Well, Dr. Heather King, thank you very much for sharing this latest with us. We appreciate it.
Oh, you're welcome. Take care.